And now we want to help you try and get through this winter. We all know the obvious hazards of severe cold, hypothermia, frostbite, but there are other potentially serious medical problems triggered by the cold. Illnesses you may not even know you have. And our medical contributor, Dr. Marie Savard, is here to tell us about them and how to protect ourselves against them. I like to get out and exercise in the cold, but it kind of like, literally takes my breath away. And I know a lot of people, they go through that.
It does. Cold air, actually, as a physician, that can be when a lot of diseases are triggered for the first time that you didn't know someone had. So think about the lungs. What happens, that dry, cold air, you're breathing it in, it can cause spasm in the airways, and for some people can lead to asthma. It can be the first onset of a really chronic respiratory condition, something like asthma. What I would recommend for people is if you feel when you're out in the cold that you have a prolonged cough, if you feel short of breath, if you kind of have a sense of wheezing, talk to your doctor about that, because you may have asthma, first of all, and it might have been missed, and they can give you a prescription inhaler, something as we have here on the set, that could actually, if you took it 20 minutes before you went outdoors, would open up the airways, allow you to exercise. But for other people with asthma who can't work outdoors, swimming inside, if they want to exercise in a pool, a heated pool, high humidity, is really very helpful. And for the rest of us, when we're outside, think about that scarf or a muffler, wrapping something around your mouth and nose so that you're breathing in warmer air. In the Olympics, some of the cross-country skiers will actually wear certain masks that reheat their own air so that they're breathing in warm air.
I have seen that. Okay, you should check with your doctor in case you're something like that. But I know definitely if you're having chest pains, and I've heard people say that when they get out in the cold, yes, you go and see the doctor about that.
It's true, but some people write it off. They think, oh, it's just the cold air, no big deal. Cold air, just as it kind of constricts our bronchial tubes, that cold, dried air can also constrict our arteries. And for people that have high blood pressure, their blood pressure can shoot up, puts a big strain on the heart. And then you've got the wind. You know, people, if you're just walking out on a windy day, that's like exercising uphill. It can trigger the onset of a new heart condition, something called angina, that chest tightness, that pressure. Sure, it might subside as soon as you stop or get out of the cold. Call your doctor about that. On the other hand, if you are someone who already knows you have a heart condition, some of my patients, I would give them a nitroglycerin tablet and say, take this 15 to 20 minutes before you go out in the cold. It'll relax the arteries, allow you to get from one place to another. But I really think the seniors have it right. In the winter, they walk the malls. Don't walk outdoors. I know, you see that. Not just seniors, honey. Right.
You know, the rest of us are in there.
It's
a great exercise inside the mall like that. I see here the hand warmers and the mittens, not the gloves, but the mittens. What is that syndrome? I've never heard about it before.
There's a condition called Raynaud's syndrome, and actually it's more common in women than in men. We don't know the cause, but you will know it if you have it. And what it is, it's a condition where actually the arteries constrict. It's not blocked arteries. They go into a spasm, usually of the hands. And if you take a look, you're going to notice your hands may go through some color changes, as you just saw. They'll first turn white from no blood going to the hands, and then they'll turn blue as the blood stagnates, and then finally red as the blood kind of rushes in. It's painful, it's numbing, tingling. Sometimes if you have this condition, as simple as going to the grocery store and grabbing an ice cream container out of the freezer will trigger an episode. If you're a person, and this has happened in my practice, where you can't even function outdoors, there is a medication, a prescription you can talk to your doctor about, something called a calcium blocker. On the other hand, just good advice, wear mittens rather than gloves. And sometimes even indoors or shopping in supermarkets, people need to wear those gloves or mittens. Don't be embarrassed about it. And if you got to wear those socks when you go to bed, that's okay too.
And the mittens, because you keep your fingers together like that, it makes all the difference in the world as opposed to being separated.
Better than gloves. Raynaud's is a really annoying condition for some people, so they should talk to their doctors. Rarely they may have a secondary underlying condition, it's some kind of autoimmune problem. Usually it's not serious.
And many people get nosebleeds in cold weather, and I think you have some remedies for that too.
I've been talking to a lot of people recently with nosebleeds. What happens in that cold, dry air, the combination outside, and then you come into the dry heat, you really dry out your mucous membranes, the passages in the nose, leads to the nosebleeds, the simple ones that you can kind of pinch off and it goes away. Good advice all through the winter. Use a lot of saline or saltwater drops. Use that a lot. Spray that in a couple times a day or more. And then dab in your nose, right inside the passages, some ointment. That will really help kind of soothe and protect those membranes so that they won't be as likely to bleed. It's a simple, easy thing to think about. It's annoying when it happens.
It certainly is. So, Marie, thank you. Thank you for that. And for all of Marie's tips, Dr. Marie, you can go to abcnews.com and click on GMA.